I just want to take a moment to introduce ourselves, the people that you're seeing on the screen. So my name is Mäkinen. I'm a physiotherapist with Lifemark. I am one of our corporate office team members who has the pleasure of working with Paul and all of our other clinicians across the country to bring great services to all of you. So certainly I'm happy to be here today with you and with Paul, and I'm going to be kind of your interviewer, asking Paul all of the questions that we have for him throughout tonight. Paul, I'll just ask you for a moment to introduce yourself if you could.
So my name is Paul Mäkinen. I am a certified pedorthist and have been for the past 17 years. I work out of the Atlantic region, so of course I service most of the clinics in our region. Currently I think I'm working out of about 14 different clinics, so it makes for an interesting ability to see a bunch of people all across the province. So it's really great. With orthotics, I've been doing them, as I say, for 17 years and 7 years for Lifemark.
Great, thanks, Paul. And so I see everybody's filling out our couple of questions that we've got on the screen, so that's great. Please feel free to type that in. We are going to loop back to some of those comments and responses there. And again, I've seen a few more people who have jumped on. Feel free to use the Q&A throughout the time, okay? So Paul, why don't we just start off with a little bit about what is a pedorthist? So again, we know there seems to be lots of different kinds of people out there who do orthotics, but what is a pedorthist, and can you tell us a little bit more about that?
Certified Pedorthist is basically a foot orthotic and an orthopedic footwear specialist. We have specialized education and training in foot orthotics and footwear. Canadian Certified Pedorthists help to alleviate pain, abnormalities, and debilitating conditions of the lower limbs and feet. So we basically see patients in the clinic, and our specialty is there to try to assess whether or not the patient may need some orthotics or whether it's just a footwear recommendation that would help them out with what they're dealing with.
Okay, that's great. Thanks so much for telling us that, because like I said, I know that sometimes it can be a little bit confusing. So I can just look at the screen. I can see that a lot of the people who are here today are here because of foot pain or hip and back pain. So certainly, definitely a number of people who want to know about these different conditions. So as we kind of go forward, we'll definitely think about that. And a lot of people who don't have orthotics currently. So I think it's a great information session for all of those folks. So why don't you tell us a little bit first, Paul, what a foot orthotic is, and maybe who needs one?
Sure. So a foot orthotic is essentially a device that you would insert into your footwear, and it serves the purpose of correcting some alignment concerns with your feet that will affect both your feet, your knees, your hips, your ankles, all of that stuff. So all of those joints above your feet can be affected by the alignment that you're presenting with. So this is what an orthotic looks like. It's an insert that will go inside your shoes. This is a custom built insert that I would go through an assessment, determine what you need, and then ask my lab service to build something specific to go into your shoes.
Who really needs a foot orthotic? Like, is there a certain age group or more women or men or anything like that?
So from my perspective, I would tell you that pretty much anybody could use an orthotic. They can benefit people from all ages, for everyone from young children up to older adults. A detailed assessment is necessary for everybody to help us determine what the best solution is for that particular person. We can confirm what that issue is through a full assessment and determine what it is that we need to do to make those corrections.
Okay, that's really great. And so again, so we can see our poll that about 50% of the people who have joined us today and filled out the poll are here because of hip and back pain, and the other big chunk of people are also kind of foot pain. So I'm just going to move us away from the polls for a minute, but let's talk a little bit more about the kinds of conditions that can be treated with foot orthotics.
Used in conjunction with proper footwear, orthotics can be effective in helping treat a multitude of conditions. Probably the most common thing that I see would be heel pain, but then of course we can obviously address arch pain, forefoot pain, shin splints, knee pain, hip, lower back pain. Anything in the lower extremity essentially is something that we could consider using orthotics to help a patient with their issues. Probably, as I said, the most common thing that I do treat would be heel pain on a day-to-day basis. So that's certainly one of the most common things that I see. Essentially, it could be just about anything, but I use a lot of my colleagues in the clinics that I work at, a lot of physiotherapists. I'll use them to help me assess what the sort of the root cause of a condition may be, and then we'll make a decision on where we go from there.
You talked about heel pain and like arch pain. I think you might have mentioned forefoot pain too. I'm just wondering if you can help us, all of us, understand what parts of the foot that really is that you're talking about.
Sure. So I got my handy dandy foot model here, and this is obviously with no skin on it, but the foot is essentially broken down into three specific areas. There's the heel, which consists of the calcaneus and the talus. There is the midfoot, which consists of these bones in through the middle, as well as the metatarsals, these longer bones that lead to the ball of your foot. And then the forefoot would consist of the metatarsal heads and, of course, all of the toes. So you can have difficulties with your feet in all of these different areas, which can lead to alignment concerns of the feet, the ankles, the knees, the hips, and the lower back, which is all obviously one of the things that we try to do when we're designing an orthotic, is improve some of those alignment concerns.
That's great. And I see a question that's come in from Peggy in the chat right now. And so she's just wondering whether orthotics can help with neuropathic foot pain, or whether, we know it's sometimes hard to diagnose these things without seeing the patient, because that is obviously quite important, but just wondering if you have any comment around that.
One of the things that I think you need to factor in or consider when you're looking at neuropathic foot pain is that there's obviously some nerve involvement, and so therefore the approach with the orthotic is not necessarily to address that specific neuropathic pain, but to also obviously think about the other underlying things that could present. For example, foot ulcers, nerve impingements, things like that, that obviously in a situation when a patient presents like that, we have to consider what's the best accommodation to account for the neuropathic pain. So it's not necessarily that with an orthotic we would be treating the neurological issues, but we would certainly be making the feet more comfortable.
A couple other questions that came in from our participants when they were registering for this event was really, and we saw it quite often, was information about heel pain, and particularly the one where kind of the scenario where the heel's really sore right upon rising in the morning, and after they kind of get moving a bit, it seems to get a bit better, but then towards the end of the day, or if they seem to be inactive for any period of time throughout the day, they also get kind of a reemergence of that pain. So is that something that you're familiar with? Is that something that is, orthotics could be helpful with? And a couple of the questions was, is this likely plantar fasciitis?
Yeah, for sure. I think there's a really good chance that, all the symptoms combined and the presentation sounds an awful lot like plantar fasciitis. For the purposes of explaining, heel pain obviously consists of your calcaneus, which is your heel bone. More often than not, what we see is that there's an increase in tension on the bottom of the foot. That tension can at times get very great, and the plantar fascia, which is a band of connective tissue that attaches right here at the base of the heel and fans out to the ball of the foot, that tissue can be under constant strain throughout the day. Let's say you stand for long periods of time at work, or you had an impact injury to that area can get really irritated and inflamed, and then the constant collapsing and straining of the arch can put a lot of tension at the base of the heel. So one of the things that we want to try to address when it comes to heel pain more commonly is to try to support the arch and take some of that tension out of the foot so that it's not constantly overstretching that tissue. Because when that tissue constantly is overstretched, you get a lot of damage right at the very base of the heel where it attaches. And the challenge is that with a condition similar to plantar fasciitis or plantar fasciitis in general, is that there's never really a time of full relief. You're constantly overstraining that tissue, and that's why it has a difficult time to really heal up. So even though you go to bed at night and maybe it feels better, those first few steps in the morning are really uncomfortable and really painful because you've kind of ripped it through a really quick stretch and caused a lot of pain and discomfort right at the base of the heel.
You mentioned about standing on your feet quite a bit, and a couple of the scenarios that we saw was like, I'm on my feet all day at work, I wear maybe steel-toed boots, and on concrete all day, and they get a complete numbness and tingling in their toes. And is that something that might be helpful with orthotics?
One of the things that people really need to pay close attention to, especially when you're in we'll say a job where you are on your feet for long periods of time, typically on hard surfaces, and the trifecta is you're obviously wearing steel-toe boots. never really great for the feet. So one of the critical things is to make sure that you have a really good fitting pair of shoes. Everything from the length, where you have about a thumb's width between your toes and the end of the shoe, so you're not banging your toes off of the end of your shoe. And the other thing is the width. You really want to make sure that you have a decent width in the toe box, because if you don't, what happens is that those metatarsals, they get cramped and they get squeezed, and when they do, one of those metatarsal heads will often get pushed downward, and then while you're standing for long periods of time, there's a constant overload of pressure onto that metatarsal head, which can often get very uncomfortable and very painful. Not to mention the fact that in between each of these metatarsal heads sits all of the nerves that feed into the muscles and the soft tissue into your toes. And so you can get this neurological zinging type pain that can present into the toes as well. So it's really important that you have great fitting footwear to start with. The last thing that I'll encourage people to focus on, especially if it's really a chronic issue, is you can use orthotics, and this is just a short version sample of an orthotic. But if you can see, I don't know if you can see it here, but there is a little metatarsal pad here at the ball of the foot, just behind the ball of the foot. You can kind of see it there, maybe on the camera. It's kind of got a little bit of a lump there at the, get over here, there we go. A little bit of a lump there at the ball of the foot, or just behind the ball of the foot. The purpose of that pad is to lift and separate those metatarsal heads.
So Paul, one of the other things that we heard a lot was, and again at the beginning we saw a lot of people here because of their back pain or their hip pain. So, we hear a lot of people say all the time, oh, my friend was recommended to get orthotics for their back problem. Should I have those, or will that help me? So what about back pain? Is that something that orthotics can actually help with?
So I've had plenty of experience creating orthotics to address lower back issues. Basically what you have to do is you have to break it down to just starting at the base. We all know that if you've got pain in your back, there's a good chance that it's coming from somewhere else, potentially. So if the foot and the gait mechanics are contributing factors to the back pain, then orthotics can have some benefit. However, if you think of it from the other side of it, if it is truly mechanical back pain, so something physically is wrong with your lower back joints, maybe your hip and how it integrates with your spine has some challenges, maybe not. Maybe the orthotic isn't going to be the ideal option in that situation.
The other question that came in advance was about diabetes and arthritis. And so we know that people with these sorts of conditions may have foot problems, but are there certain types of orthotics or certain types of conditions with a diabetic or arthritic foot that might be really helpful for those individuals to think about?
A couple of factors, a couple of things you need to really factor in when you're dealing with arthritic and diabetic patients. One of them is that we need to try to be as soft and shock absorbing as possible. Obviously in an arthritic case, the joints are really painful, they're inflamed, and they're quite uncomfortable on a consistent basis. So essentially what we want to do, I'll show kind of two small examples here. This is one orthotic, but you can tell that that's a really hard, rigid plastic material. Maybe I'm going to avoid that with somebody who's an arthritic or a diabetic. This one here is a softer, more shock-absorbing material. It's a couple of layers that you can see, the sort of the black and white layers laminated together to give it some stability and allow us to build some correction into the orthotic, but also at the same time softer and more shock-absorbing. Other factor that you really need to pay close attention to, especially with diabetics, is the condition of peripheral neuropathy. One of the challenges that we run into with diabetic patients is that quite often they'll present to the clinic and they can't feel their feet properly. So there's just not that sensation of pain, discomfort. Sometimes I've even seen patients with, cuts or holes in the bottom of their foot, an ulcer, and they literally cannot feel that.
So Paul, you talked a little bit ago about an orthotic being something that you could get off the shelf, from the drugstore or whatever. So can you tell us a little bit, before we get to a couple more of the condition questions, what the difference is between a custom orthotic, like what you're talking about, and kind of those off the shelf where, you go to Costco and you stand on the little thing in the pharmacy area and it tells you which things to buy. What's the difference?
Of course, the most recognizable difference is literally that one is custom and one is not. A custom-made orthotic is designed specifically for the patient in mind. 3D image of the bottom of the foot or a 3D cast of the foot is taken. That information is, of course, sent to our lab service. or maybe even fabricated by the clinician themselves. But that's 3D, it's used to make a 3D model of the foot. Then of course the orthotic is then designed with all of the proper corrections and features built into it, and then built from scratch.
How do I figure out what my best option is? Like, so I don't want to buy the off-the-shelf one maybe because I have a problem with my foot, but how do I know who's doing it kind of to the best practice or whatever that might be?
Of course, being a Canadian Certified Pedorthist, I have to say that it is my daily focus. It is what I do every day. And so therefore, I have to say that we are the best. We're the most proficient at it. We spend all day, every day analyzing people's gait, mechanics, range of motion testing. A good, thorough assessment is really the critical starting point. If you go to see somebody who's literally, here, walk across this pad on the floor and we'll design you an orthotic, you got to start to question whether or not the effectiveness of that device is going to be there. Versus, somebody taking good time to go through that full range of motion testing, a full medical history with you, talking about what the problem is, and as a result, trying to figure out what the solution is. I can tell you for sure, if you're not, hands down, if you're not getting some form of a three-dimensional cast of your foot done, it's probably not the best approach.
Just to follow up about this kind of over-the-counter one, is there any sort of condition that they would actually be helpful for, I guess? Like, I'm just thinking, if I don't have any particular problems, and maybe I just work at the grocery store and I have to stand all the time on my feet or something like that, but is that where those kind of come into play? I'm just really actually thinking myself right now, kind of where do those fit?
At the end of the day, there's plenty of times in the clinic setting where I'll see a patient and I'll just literally say, listen, your mechanics are pretty good. Your alignment is pretty good, but I can understand you're having some general discomfort in your feet. You end the shift at work and you're like, oof, my feet are really tired. That's usually a precursor to maybe something that's going to be problematic down the road. So if there's something there that we could address with a custom orthotic, maybe we'll consider it. But I also quite regularly just recommend a good off-the-shelf insole that has great cushioning, a decent amount of support, and typically full length. Buy new shoes more often, more regular, and maybe consider this brand versus that brand, and sometimes that's all it takes.
How long do these things last? So how long does a foot orthotic last? How often am I going to have to replace it? Those kinds of things.
First off, I'm going to tell you there's a whole host of factors that kind of come into play. Number one, what are you doing with them? So activities-wise, are they in your running shoes and you're pounding on them, 5 days a week? Are you only wearing them maybe in your dress shoes because it's a dress style orthotic? So lots of time is one of the things that you need to sort of factor in. How much time do you spend on them? Second thing is, what materials are they made of? This hard, rigid plastic orthotic is likely going to last you longer than this softer, more shock-absorbing orthotic. The other thing you need to factor in is what are we addressing? So, for example, the diabetic patient, they're not going to go for very long because I need to see them more regularly and more consistently to say, are we running into troubles? And if we are, we need to address those right away. Then material choices. So the top cover material, just because that top cover is worn out doesn't necessarily mean that the orthotic is completely worn out. Sometimes all you need is just a strip down and a fresh recover of the orthotic, top and bottom cover, and it feels like a brand new orthotic again. So let's just talk sort of start to finish a basic orthotic assessment. So you come in, you get your assessment done, we determine, okay, I think orthotics are a good option for you. So then the first thing that we're going to do is we're going to cast the foot and we're going to send that off to the lab. Lab's going to fabricate the orthotics. In my situation, the lab is going to fabricate them. It takes about 2 weeks to get those orthotics completed. Once those orthotics are completed and back from the lab, we need to book you in for a 2-week fitting appointment. So essentially sit down, check everything over, make sure they are designed the way I asked for them to be designed, check the fit, make sure everything looks good, and then I may have to trim them up a little bit to fit them in specific shoes. We're going to look at the shoes that you're intending on putting them in. Maybe we need to make some better recommendations. Maybe we need to make some suggestions that this one's not the ideal shoe. And then from there, I'm going to send you off to go start the break-in process. So you're going to start off at an hour the first day, then 2 hours the second, and then 3 hours the third. And so you're going to build up over time. And typically within 3 to 4 weeks, I would hope that all of my patients are comfortable. And if they are, then great, they just keep on plugging.
The question specifically from Cindy is, what about if you don't have insurance? She's just trying to get an idea of kind of what that looks like.
Most clinics would have some form of an assessment fee. Typically, a standard fee and it's going to differ. It's going to be different region to region. Here in the Atlantic region, we'll do an assessment. There is a fee associated with that. However, if we decide that an orthotic is a necessity and we go through the channels of making sure you have the prescription and everything's ready to go for your insurance provider, then we're going to roll the cost of that assessment right into the cost of the orthotic, okay? So we're not going to have two separate charges on an invoice that you're going to send to your insurance provider, because unfortunately today a lot of those insurance providers are not going to provide coverage for just the assessment alone. They're going to provide coverage for custom foot orthotics. So that's how we kind of get around, trying to get you as much covered through your plan as possible. The great thing is that having 17 years of experience, I do know specifics of what the insurance providers want. I know what paperwork they're going to ask for.
Bill is asking, what would you do for Achilles tendinitis? So is that something that you can help with from an orthotics perspective?
I'm going to start off, Bill, by saying, first off, everything I say is not set in stone. I mean, obviously, everything comes with a full assessment. I have to do a full assessment. We have to factor in all of the details. Having said that, Achilles tendinitis can be really frustrating and debilitating. Typically, when I see it, it's either going to be caused by too much tension through the posterior chain, so short calf muscle, short hamstrings, resulting in too much pull and tension at the base of the Achilles, right at where it attaches to the heel bone. So that's typically the first cause. Second cause is a foot that tips inward or outward excessively, putting a bowing position to that Achilles on a regular basis. And then add in the tension as the heel raises while it's in a bowed position, and that puts a lot of stress and strain where the tendon attaches to the bone. So those are kind of a couple of things. What am I going to do in those cases? Well, if it is a posterior chain tension, so just because everything is short, sometimes we'll do a temporary lift underneath the heel. Just raising the heel up a little bit takes a little bit of that tension off the posterior chain, reducing some of the strain right at the attachment site.
You just talked to all of us about what pronation is and what's bad or is there bad pronation, and what supination is, just for our friends that maybe are wearing out the outside heel of their shoes.
Let's be completely honest. Pronation is natural. It's needed. It's exactly how the body goes through its own natural cushioning and shock absorbency. So the foot will land, typically, foot will swing through, outside edge of the heel will touch down a little bit. Then what will happen is you'll go into mid-stance or mid-stance position. In the mid-stance position, if you tip inward too much, it's hard to see because this is not great, but if you roll inward too much, that's overpronation or excessive pronation, which inevitably will cause an awful lot of collapse in the arch typically. We'll put a lot of tension on all of the muscles that are attached to the leg and the lower limb, putting stress and strain on those, so like shin splints and things like that. And so what I was saying earlier, a little bit of pronation is normal. We need that to create the windlass effect in the foot, which is a locking up of the lateral column against the cuboid bone here, and then a propulsion forward so that you can go into the toe-off position. You need a little bit of pronation to be able to do that. On the flip side of that, supination is the tipping outward of the foot. So if this is the back of the foot, it's tipping to the outside edge and forcing the patient to walk a lot more along the lateral border or the outside column of the foot. It will often lead to a big knee shift, a big hip shift, and those people tend to really present with a lot of medial knee stress, lateral hip stress. Correction is a really difficult terminology, okay? Because let's be honest, I often describe to my patients as orthotics are very similar to glasses, okay? Everybody who has glasses will put them on their eyes, it will fix some deficiency, they can see. But the minute the glasses come off the eyes, you can't see anything. So we've got to remember that, think of an orthotic in this similar fashion. When that orthotic is in your footwear and it is addressing some of those alignment concerns to get you closer to a neutral position or a neutral gait pattern, it's working while you're using it. So probably the most common thing that you've got to factor in when you're thinking about bunions, number one is foot mechanics. 9 times out of 10 when I've seen a patient, what sort of the causative factor is not necessarily the joint itself, it's the mechanics that led to excessive pronation, specifically excessive forefoot pronation, that as they're going into that toe-off position, they really jam over hard towards the big toe, and that essentially pushes that big toe medially as they're going into that toe-off position, and it results in a whole lot of irritation, discomfort in that big toe joint.
Is it okay to wear old orthotics in maybe one pair of sneakers and wear maybe a new set of orthotics, say in your hiking boots? And this gentleman is saying that due to his back, he does this and he ties them tight enough and, you know, make that long shoehorn to put them on and everything like that. But is that something that's okay, or do you recommend that?
You know, if you've got an old pair of orthotics and they've been assessed by somebody, and let's say you saw me and we're doing a new pair, I typically will say stick that old pair in an old pair of boots, shoes that you're wearing on a semi-regular basis, not your day-to-day footwear. The new one's got to go in the day-to-day footwear. So it is okay for him to certainly use those old ones. I would encourage him to certainly use them, but use them in a shoe that he's not doing it very consistently in.
That's great. Thanks, Paul. All right, and then I think the last question that we've got right now is just around if there are certain types of exercises for plantar fasciitis, and I guess, you know, do you recommend exercises as well, or is that something that you lean on your other clinician colleagues to take?
Yeah, when it comes to exercise therapy or recommendations, I certainly would refer or defer to my colleagues. You know, all of the clinics that I'm in are multidisciplinary clinics. I work with a lot of colleagues who have way more knowledge about that than I do, and so therefore I would certainly encourage you to discuss that with them. Having said that, I know a few things that I've learned over the years that I can certainly impart on my patients to make sure that you're moving in the right direction. But it's important to seek advice if you do have any questions from one of my colleagues.
That's great. Thank you, Paul. And JJ and Sarah, I see that you guys have your hand up in the room. Unfortunately, we have set it up so that we can't have our participants enable the mics, just for, you know, privacy and all that type of stuff. If you do have a question, please feel free to type that into the chat and we'll take a look at that as well. So I'm just going to go on back to our other screen here for a minute as we come to the end of our questions. So again, as I was saying, you can certainly connect with Paul directly on Facebook and Instagram, and he posts tons of great content all the time. Follow Paul at the Pedorthist, or Paul the Pedorthist, sorry. But you can also find lots of great content from Paul and all of our other clinicians as well on our Facebook page for Lifemark Health, as well as Instagram and Twitter. I did put the lifemark.ca website as well in the chat. Hopefully I put it in the right spot. Heather, let me know if I didn't. But there's lots of great blog content on there as well. So Paul's been a feature author on a number of occasions in various different topics as well there. So if you're looking for some more information on any particular conditions or anything like that, then please do check that out. So Paul, just before we sign off for the night, any final words for our attendees about what they should know or what they should do around orthotics?
Sure. First of all, guys, I apologize for any issues that we might be having with the microphone, the camera. This is literally webinar number 1 that we're posting out there. We're the testers. We'll see how it goes, and then we'll have great opportunities for more different topics in the future. But thank you for coming in. You know, I think it was about 17 or 18 total participants that kind of joined us. We appreciate your time. I thank you for taking the time to come in and listen to us. Most important thing that I can impart as we leave is if you're having any difficulties, any aches, pains, problems that are lower extremity or lower limb based, so feet, knees, hips, lower back, think about it that maybe an orthotic might be beneficial for you. But it's always critical to get a thorough assessment done, and so if you do that, you're taking a step in the right direction. For sure, if you live in Atlantic Canada and would like to seek some advice from me, catch me at one of the clinics. I think we've in the Q&A right now, actually, or in in the Q&A, there is a link right there to my profile on the Lifemark website. You can certainly hop in there. It'll give you details of what clinics I work at. I cover all of Nova Scotia for the most part, as well as you can book sometimes. Certain clinics you can book online, so it just makes it a whole lot easier. Lifemark.ca, as Krista said, is an amazing resource. Go to the blog section, tons of great articles there on everything that you can think of. Obviously, pedorthic stuff, but also occupational therapy, physiotherapy, chiropractic, you name it, great resources. So check it out. Other than that, I think that's it. As Krista said, at Paul the Pedorthist on Instagram or Facebook. Feel free to DM me anytime if you have more questions. I'm happy to answer them. Anybody who didn't get their questions answered, if you'd like to shoot me off an email, again, if you go to the Lifemark website, go to my profile, you'll be able to send me an email as well.
That's great. And you can even book online with Paul if you so desire as well. So that's great. Yeah, and so as Paul said, we all want to thank all of you for taking time to join us today and for being interested in learning more about orthotics and how it might help you with your particular health or situation. So again, please feel free to access the recording when we send it to you via email. We will be asking for some of your feedback about this session. As Paul said, it's our first live patient education webinar that we're doing in this way, and we do want to continue to do more and more to provide more opportunities to share with our potential patients out there how we might be able to help in all of our expertise. So watch out for those emails and content coming your way as well. I think that brings us to the end of our session. Again, thank you to everyone. Thank you for all of the Lifemark folks who helped make this happen. And thank you, Paul, for sharing your knowledge and expertise with us so openly and willingly. So thanks very much, everybody.
Thanks, Krista.
Have a great day, everyone. You're welcome.